Tonight, a sharp divide continues over President Trump's budget bill. Here's a live look at the U.S. Capitol, where a sweeping Republican measure still awaits approval in the Senate after clearing the House.
The plan includes $350 billion for border security, deportations, and also spending and tax cuts. A new analysis undercuts GOP claims that the plan won't add to annual deficits. According to the nonpartisan Congressional Budget Office, the proposal would add about $2 trillion to deficits over the next decade.
The Budget Office says the tax cut program the House passed would be the biggest driver of future deficits. To help pay for the program, it says the measure would scale back spending on safety net programs.
That includes SNAP, Medicaid, along with federal and state health programs for low-income, elderly, and disabled Americans. The analysis also says hundreds of thousands of Georgians could find themselves without health insurance.
Hunter King shares more about the potential impacts.
President Trump has given a July 4th deadline to have this bill passed by both the House and the Senate, but some people are worried about the cuts to Medicaid. The Congressional Budget Office estimates more than 624,000 Georgians could lose their health coverage by 2034 under the Republican-backed One Big Beautiful Bill. That includes over 530,000 people losing Affordable Care Act marketplace plans and 93,000 losing Medicaid coverage.
These, administrative changes are pretty seismic shifts that could cause, huge coverage losses and really hurt Georgia's healthcare safety net.
The bill would eliminate enhanced premium tax credits that help Georgians afford their insurance through the state marketplace. It would also add new work requirements and administrative burdens to Medicaid. For families, the financial impact could be severe. According to Griggs, a single parent could see premiums jump by over $1,000 per year.
Coverage will suddenly, almost overnight, become completely unaffordable.
But some Republicans say the changes are necessary to eliminate fraud and ensure programs serve those who truly need them.
The people that are eligible for Medicaid, they will not be cut off. That's what I'm told. I'm also told that the whole purpose and the revaluation of Medicaid is because there are so many people that are on there that should not be.
Here in Houston County, an estimated 15,000 to 22,000 residents rely on Medicaid coverage. Georgia just achieved record enrollment of 1.5 million residents this year in marketplace plans under the American Care Act. Reporting in Warner Robins, Hunter King, 13 WMAZ News.
The analysis only represents a snapshot as the Senate continues to work on the bill. Senators are expected to amend the bill and send it back to the House for its final approval. If passed, President Trump could sign it into law.